Hello dear, I am Mumtaz Badshah. You are watching Health+Pharma Info Lab. Today we will discuss about paracetamol. We will discuss about the introduction of paracetamol, mechanism of action of paracetamol, uses of paracetamol, dosage of paracetamol, and side effects of paracetamol. Introduction of paracetamol. Paracetamol is one of the most commonly used pain relievers in the world, and it is available without a prescription in many countries. Paracetamol, also known as acetaminophen, is a widely used medication for the relief of pain and fever. It is available in various forms, including tablets, capsules, and liquid suspension. Mechanism of action. Paracetamol is thought to block the action of an enzyme called cyclooxygenase (COX), which is responsible for the production of prostaglandins. Prostaglandins, which are chemicals in the body that cause pain, inflammation, and fever. Uses of paracetamol. 1. Pain relief. Paracetamol is used to relieve mild to moderate pain, such as headache, toothache, menstrual cramps, and musculoskeletal pain. 2. Fever reduction. Paracetamol is also used to reduce fever associated with various conditions such as cold, flu, and other viral infections. 3. Arthritis. Paracetamol is used in the management of pain associated with arthritis, including osteoarthritis and rheumatoid arthritis. 4. Postoperative pain. Paracetamol is used as an analgesic in the management of pain after surgery. 5. Migraine. Paracetamol is used as a first-line treatment for mild to moderate migraine headaches. Dosage of paracetamol. For adults and children over 12 years old, the recommended dose is usually 500 to 1000 mg (mg) every 4 to 6 hours, up to a maximum of 4000 mg per day. For children aged 6 months to 2 years, the recommended dose is 60 mg to 120 mg every 4 to 6 hours, up to a maximum of 480 mg per day. For children aged 2 to 4 years, the recommended dose is 120 mg to 240 mg every 4 to 6 hours, up to a maximum of 960 mg per day. For children aged 4 to 6 years, the recommended dose is 240 mg to 360 mg every 4 to 6 hours, up to a maximum of 1440 mg per day. For children aged 6 to 12 years, the recommended dose is 360 mg to 480 mg every 4 to 6 hours, up to a maximum of 2400 mg per day. It's important to use paracetamol only as directed and to avoid exceeding the maximum daily dose. If you have any concerns or questions about dosing, it's best to speak with a healthcare provider or pharmacist. Side effects of paracetamol. It is generally considered safe. However, like any medication, it can cause side effects. Some common side effects of paracetamol include 1. Nausea and vomiting. 2. Stomach pain or discomfort. 3. Loss of appetite. 4. Skin rash or itching. 5. Headache or dizziness. 6. Difficulty sleeping. 6. Liver damage. In rare cases, paracetamol can cause serious side effects such as liver damage, particularly if taken in large doses or over a long period of time. It is important to follow the recommended dosage instructions and to avoid taking more than the maximum daily dose. If you like what you see, don't forget to hit the subscribe button and turn on notifications so you never miss a video from us.